friends, I am Dr. Prashant Sharma and you are watching Medicos Hub 2. This is a series of lectures on neuromuscular blocking agents and I am going to discuss the mechanism of non-depolarizing blockers in this video. Few important points before we start the non-depolarizing block. These are acetylcholine receptors on end plate or motor end plate, and these acetylcholine receptors are nicotinic type, NM type. Now few important points regarding these receptors. These receptors are made up of 5 subunits. 2 are alpha, 1 beta, 1 gamma or eta, and 1 delta. These 2 alpha subunits are having acetylcholine binding sites, and these sites are having negatively charged groups that bind with the cationic head of acetylcholine, and these are cholinergic receptors on motor nerve endings. So acetylcholine binds with the acetylcholine receptors with the acetylcholine binding sites on alpha subunits, and it also binds with cholinergic receptors on motor nerve endings. Some of the molecules bind to these receptors also. When activated, these receptors result in transport of additional quanta of acetylcholine from the axon to the terminal. So this transport is facilitated by activation of pre-terminal cholinergic receptors. Now, what will be the mechanism of non-depolarizing block? Such block is done by competitive blockers. Such molecules are known as competitive blockers. These include Curare and related drugs, which are having 2 important features. First one, these have 2 or more quaternary N+ atoms, and second, these are bulky molecules. Now, there are 3 basic mechanisms by which this block proceeds. First one, competitive blockers bind with the acetylcholine binding sites, because quaternary N+ atoms provide necessary attraction to the site, but it's important to note that the bulky nature of molecule will prevent the conformational change in the acetylcholine receptors, but the bulky nature will prevent the conformational change in AChR and as more and more AChR are involved, that is blocked, then magnitude of end plate potential decreases and muscle action potential is not achieved. So this is the most important mechanism involved. Now the second mechanism is that if concentration of competitive blocker is high, then these can enter the sodium channel and block it directly. So the block is more potentiated. This is the second mechanism. And the third mechanism is that it will also prevent the binding of ACH to the cholinergic receptors on pre-junctional area. So third one is that inhibition of binding of acetylcholine to pre-junctional receptors. This blockage can be antagonized by acetylcholine in vitro and neostigmine in vivo, and this blockage can be partially antagonized by neostigmine. Important thing is that such blockers exhibit fade phenomenon, or they result in fade phenomenon, which means that twitch responses in condition of partial blockage will show decrease in magnitude progressively if repeated stimuli is given. So that is fade phenomenon. In next video we'll discuss the mechanism of depolarizing block. Hit the like button, share and subscribe our channel to get the latest updates and notifications.